Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Tracking ticks in New York State is providing a lot of important information about tick-borne diseases, and one thing Dr. Saravanan Thangamani has noticed is that sometimes people will get more than one disease from a single tick bite. He's here today to fill us in on the trends he's seeing. Dr. Thangamani is a SUNY Empire Innovation professor in the Department of Microbiology and Immunology at Upstate, and he directs the SUNY Center for Vector-Borne Diseases. Welcome back to The Informed Patient, Dr. Thangamani.
Good morning. I'm happy to be back here, and it is active tick season, so I'll be more than happy to talk about ticks and tick-borne diseases and co-infections.
Now, you founded the Thangamani Lab at Upstate, which has been testing ticks since 2019, and you're close to having tested 30,000 ticks at this point. What % of these ticks are positive for at least one pathogen?
From our own passive surveillance assay, if I can clarify that, is the ticks that are encountered by humans, either on themselves or on their pets. They send it to a lab for testing. That's called passive surveillance. From that surveillance, based on the data that we have been accumulating since 2019, I can tell that at the least 1 in 3 ticks carry at least one pathogen. But this is normalized across all of our data. But if I drill down, if I focus on a specific county, like Central New York, one of the counties in Central New York or Lower Hudson Valley, the percentage rate of prevalence of the pathogen in the tick population can rise as close to 40 to 50%. So, but in a generic sense, 1 in 3 ticks carry at least one tick-borne agent, but that number continues to increase. So from 33%, now we are seeing closer to 35%. So the number slowly increases.
Well, how common is it for a tick to have more than one pathogen?
Oftentimes people think that a tick only transmits a single disease-causing agent to a human upon the bite, but deer tick specifically can transmit multiple disease-causing agents to humans, and nearly 11% of the ticks actually carry 2 pathogens, means that they can transmit 2 pathogens to humans, and 4% of the ticks carry 3 pathogens. And then there is a fraction of percentage, 0.05, carry 4 pathogen. And imagine a single tick bite can give you not just one disease, can give you 3 to 4 diseases. And it is becoming much more common that we find in the lab, the co-infections.
Now, you mentioned deer tick. Are there other ticks in New York State?
Yes, deer ticks are the most common one. It's widely spread throughout the state. However, we do have dog ticks and lone star ticks that are actually present in large numbers, and it was traditionally recognized, I would say, in the Lower Hudson Valley and tri-state area. However, in the past years, we are seeing these ticks are actually, I would say, exploding in Central New York and Western New York as well, and they do carry disease-causing agents as well.
Can any of these ticks carry any pathogen?
Oh, yes, they can carry pathogens such as disease that can cause ehrlichiosis, rickettsiosis, and also the bites of lone star ticks are the ones that cause the alpha-gal allergy, otherwise called meat allergy.
Well, let's talk about the 3 primary tick-borne pathogens that cause human illness in Central New York. I know deer ticks are known for carrying the bacteria that causes Lyme. How long does the tick have to be attached to transmit that bacteria?
Based on the scientific literature, what is currently available, and to my knowledge, it takes at least 24 to 48 hours for the deer tick to transmit Lyme disease agent to a human. The reason is that this bacteria reside in the gut until it actually takes the next blood meal, which means that as soon as the blood is starting to enter into the midgut of the tick, the Borrelia start to replicate in more numbers and leave the midgut, like stomach, equivalent of a stomach, and then go to the salivary gland of the tick. And from there, it can deposit onto the skin while it is taking the blood meal. So the biology of this bacteria is such that it requires some time to multiply and travel all the way to the feeding site. And that's why it takes about 24 to 48 hours. There are cases where very odd cases that people have demonstrated or reported the Borrelia transmitted early, but it is not very clear that have they had the Lyme disease before. If they had it, it would actually, appear much earlier. It's like flaring of Borrelia in that site of feeding. But I would say from my scientific mind, it takes about 24 to 48 hours. And I think this is something that is commonly misunderstood. However, other pathogens like virus can be delivered right away. Rickettsia, Ehrlichia, or Babesia, they somewhere between 12 to 24 hours, they take time to do. Babesia can be a little later as well. So yes, we talk about the Lyme disease, it takes a while. However, there are other disease-causing agents that can be transmitted to humans as soon as, I would say, the tick attaches on a mammal or human body.
Now, if the tick was unnoticed, what would happen to it after it has that blood meal?
So what happens is that they feed to repletion and they drop off. And it will, the next 3 to 4 weeks, it will actually molt and will enter the next stage. For example, if the nymphal tick is feeding on a human, that are so tiny, easy to, not notice on a human body, they drop off. They will find some nice corner, stay there. It doesn't need any blood. It doesn't need any food because it already got everything. And it's enough. It has enough storage, metabolic storage for it to survive another 6 to 8 weeks with no problem. And then it will metamorphose into another life cycle stage, either a male or a female tick.
Well, if the bacteria was transmitted into the person during the blood meal, how soon before the person might notice symptoms of Lyme disease?
So anywhere from 3 to 30 days, particularly for the Lyme. For a good portion of the people, they might see a bullseye rash or some other rash, but not everybody will get the rash. So you have to rely on additional clinical symptoms like fatigue or arthralgia, acute febrile illness. If someone has an acute febrile illness post a tick bite, they should go to a clinician's public health provider right away. Those are a telltale sign that something is actually transmitted to them, be it Lyme disease agent or some other agent.
You're listening to Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Saravanan Thangamani, director of the SUNY Center for Vector-Borne Diseases. Another bacteria that deer ticks may carry causes anaplasmosis. Can you tell us what that is?
So anaplasmosis is an intracellular bacterial agent. It is also transmitted by the deer tick during the tick bites. Very similar to the other tick-borne agents. The first set of clinical symptoms one would observe is acute febrile illness, fever, and sometimes they may have some sort of a rash that doesn't look like the Lyme disease rash, but it will be something else. And maybe they can have a scar or a scaled skin at the site of tick bites. Those are the telltale signs, I would say. If left untreated, it can be fatal. So that's one thing. But the good thing is that if diagnosed early, and the same antibiotic that helps to treat Lyme disease can also be used to treat anaplasmosis as well. So in a way, I think that for treating both Lyme disease and anaplasmosis, the doxycycline antibiotic is a good measure. But however, I must disclaim here that I'm just a tick doctor. I'm not a human doctor. So it is just scientific information I'm disseminating. And almost like 9% of the ticks carry anaplasmosis agent. And the anaplasmosis is slowly on the rise in New York. I can tell from tracking the disease incidence cases and all human cases and also the ticks. We are seeing an increased number of anaplasma positive ticks. And anecdotally, I've been told by many clinicians in our area that they are seeing more anaplasmosis in human cases as well.
That's a little scary. You mentioned Babesia also. Now that comes to deer ticks may transmit this, but that's a parasite, right?
Exactly. So that is a parasite. That's why you have to treat with a different set of drugs. Babesia is almost like a malaria parasite. The malaria parasite is transmitted by mosquitoes, but Babesia parasite is transmitted by ticks. But they all target the same blood cells, cause a similar disease, and it can be highly fatal as well if left untreated. And I think this is also on the rise I would say, throughout the United States, specifically in the New York State.
So what happens if you're infected with Lyme and Babesia? Does that complicate treatment? I know you said that Lyme and anaplasmosis are treated with the same medication typically, But does it complicate treatment for a person to have two diseases at once?
That's a great question. Yes, it does complicate. There are two things that can happen. When a human gets more than one pathogen, it exacerbates the clinical outcome of those disease by itself or in a combination effect, right? So it makes the people more susceptible to disease, maybe clinical outcomes, longer recovery periods and everything. If it is Lyme and anaplasma, yes, there is a common solution to it. However, for Babesia, it is a different. So now the clinician has to come into play to see how to treat the patient, right? They have to treat Lyme and also parallelly they have to treat Babesia as well. And then they have to look at the combinatorial effects of these medications as well. So it complicates the treatment and also it extends the recovery time of the patient. And hopefully it doesn't lead to some, long-term sequelae as well. So it's much more complicated to treat.
Are there other pathogens that you're finding that typically occur along with Lyme?
So there are three pathogens that most commonly occur with the Lyme disease agent, Borrelia burgdorferi. The top one is the anaplasma co-infection. The second one is Babesia co-infection. The third one is my favorite, Powassan virus. And in my lab, my lab works with Powassan virus extensively, and we have observed that Powassan virus positive ticks almost always carry Borrelia in them, which means that Powassan always co-infects with Borrelia. I can confidently say that nearly 70% of the ticks that are infected with Powassan also has Borrelia. And we are in the lab, we are trying to understand the clinical consequence of co-infection when a tick is transmitting both Powassan virus and Borrelia at the same time. What are the clinical consequences of it? Does it impact the recovery time of the patient, or does it make the case much more severe? Because Powassan is a neuroinvasive disease. Powassan virus causes neuroinvasive disease. It infects neuronal cells. It kills the neuronal cells. So in that case, how does it impact, I would say, clinical outcome of Lyme disease and also treatment and recoveries? That is a project that one of my MD PhD students is now investigating.
Powassan, does that leave lasting neurological damage?
Yes, actually. So Powassan causes symptomatic infections. And within the symptomatic infection, one can get acute febrile illness, recover very quickly. In the worst case scenario, virus will actually traverse from the skin to the central nervous system through the spinal cord. It can infect the spinal cord and then goes all the way to the brain. And depending on where the virus is, one can get meningitis or meningoencephalitis. 15% of those who get meningitis or meningoencephalitis might succumb to the disease. However, 50% of the survivors will have long-term neurological sequelae. So it is a rare disease. However, it's a fatal disease. If not fatal, it will have long-term neurological sequelae. They will have speech difficulties. They will not be able to stand up on their own. They will not be able to talk coherently. So there's a lot of, it will impact the quality of life, and they may not be able to live without any assistance, particularly in old age population.
Your lab was working on developing an anti-tick vaccine. Where do things stand with that?
Yes, we have made significant improvement. We have identified a few candidates of interest in a preclinical model, and we are further evaluating the efficacy of these candidates. And I would say we have also applied for funds to evaluate this in a preclinical model much more effectively so that we can take it to the next level. So we are doing it. We made significant progress, but it takes time to discover something and then bring it to a market that can be used on people. It takes such a long time. That's why I always tell that my lab has been trying to do this anti-tick vaccine development for nearly 20 years now. We had some successes preclinically, we had some failures, but it takes such a long time to develop and bring it to the market, right? However, the tick testing program that the lab is doing, I'm actually impacting someone's life every single day. And that is something that I'm really very happy to do it. And also maybe that's my motivation that I continue to do it, even though there are a lot of bottlenecks to do that. As a small academic lab to do this kind of large endeavor, we had to go through a lot of bottlenecks, but the only thing that motivates me to do is that the tick testing program is helping someone every single day. But my anti-tick vaccine program, it'll take 10, 15 years for me to actually do that community impact. But with the tick testing program, I'm actually impacting the community every single day. So I'm really happy to do that. But unfortunately, that's the nature of the science, right? We have to discover and then test it until we find this one good candidate or multiple combination of candidates to take it to the vaccine level.
Tell us a little more about the tick testing program and how it works. The website is at nyticks.org.
Yes, you're right. The website is nyticks.org. So the tick testing program is also called as the passive surveillance or citizen science surveillance program, where when someone finds a tick on themselves or on their pet, they can go to our website, submit the tick following some instructions, and send it to the lab. And in the lab, we actually surface sterilize the tick, homogenize the tick into millions of pieces into special cocktail solution that allows us to extract the biological material from the tick. And those biological material are then put into our PCR systems, similar to how SARS-CoV-2 was diagnosed. And we look for 16 different pathogens. So each tick is actually processed to identify 16 different pathogens. And then we send the results back to the tick submitter. And the tick submitter then, at their discretion, can take that result to a clinician. This is not replacing human clinical diagnosis, but it simply provides a risk of pathogen exposure to the clinician. And clinician, at his or her discretion, can decide how to take the results. Can they actually proactively treat the patient, or can they monitor the patient a little longer? So we are actually improving the clinical diagnosis of tick and tick-borne diseases with our system. In addition to providing the results to the public, we gather all these data. So we decided to develop a public map, which is called Tick Map. It's a dashboard similar to Johns Hopkins COVID dashboard. We actually put our data into the public domain, where the tick was found and what are the pathogens they carry. And they are up to the county level accuracy. And the zip code level accuracy, we actually share with the public health laboratories because we don't want to put that in open domain. We allow the county health departments or state health departments or CDC to decide how they want to disseminate that granular level data. So that map, before we had only for the New York State, now we have for the entire United States because our program is now expanded throughout the United States. So depending on the state of your interest, you can use a drop-down menu to look for a specific state. And then depending on the county of your interest, you can double click on the county. It'll pull up all the data for that. And you will find what ticks are there, what life cycle stage were there, and what is the rate of prevalence of tick-borne pathogens in that county. We also have a date sliding bar. So you can actually choose, hey, this is the time period I want to look for, and you can look for it. And anecdotally, I can tell that many clinicians, when I give grand rounds talk or in conferences, they come to me and say that, hey, Saravanan, I'm actually looking at your dashboard, and a patient came to my office with a tick bite. And the first thing I did is I went and checked your tick map dashboard, and I found that anaplasma was increasing, or you're reporting anaplasma is increasing. That allowed the clinician to actually add anaplasma to the differential diagnosis and treated the patient. So anecdotally, we are getting this information, not just in Central New York, not just in Syracuse. So I'm hearing this information from the clinician who are actually using our data to treat the patients. And so this is a welcoming sign. Again, the disclaimer is it doesn't replace human clinical diagnosis. However, it actually provides additional set of information for the clinicians to make informed decisions to treat the patient.
What is the turnaround time if someone submits a tick through the mail, and once it gets to your lab, how quickly is it turned around?
Our turnaround time is 1 to 2 days now. Although officially we say 2 to 3 days, but we have the capacity to do within 24 hours turnaround time as well. So we do our best to send the results back to the submitter within a day or two. The idea is that the earlier I give the results to them, they can actually go take the data to the clinical healthcare provider. Because if these tick-borne diseases, be it the Lyme disease agent, anaplasma, babesiosis, if they are detected early, if they are treated early, it can be effective. If not treated early, then they can have these little longer consequences. So that's my idea, is that if I'm going to test it and provide them, I want to give them as soon as possible so they can actually seek expedited healthcare solutions.
I know the instructions are on your website, but can you tell us how a person should remove the tick and how they should package it for sending?
So when someone finds a tick on them, the first thing I would tell them is do not panic. Only 1/3 of the ticks carry the tick-borne disease. There is 2/3 doesn't carry. So there is a higher chance that that tick may be the 2/3. So first thing I will tell them is not to panic. And then, take a small blunted tweezer and go all the way to the feeding side. That is where the mouth is inserted onto the skin. Gently pull it straight upwards. No wiggling, no moving in either direction. Just pull upwards and ensure that you're pulling the entire tick, including the mouth parts. You don't want to leave any parts inside. And then put the tick in a small Ziploc bag. And then immediately wash the tick feeding site with a soap or wipe it with an alcohol wipe. And I would say look for any signs of rash, I would say a day or 2 or 3 days post the tick bite. So continuously monitor the tick site for any signs of rash or inflammation. And if needed, I tell people, maybe you can take a picture. These days, everybody has a picture, right? You can take a picture right after you pull. And then 2 days after, if you see some redness, you can actually compare. Hey, this is my day 0. This is my day 2. Am I seeing a difference? And that might be a good, valuable information for the clinical provider as well, right? And then add a small moist paper into the Ziploc bag so that the tick is kept a little fresh, I would say. The ticks like humidity. So if you put that a little bit and then close it, and then send it to any tick testing lab. I know if you send it to our lab, that would be great, but there are other tick testing labs that do, but because we are a state institution, we are not charging a lot to the people. We are trying to keep it at an operational level. So send it to a tick testing lab, I would say, as soon as possible, so you know if the tick that bit you carry any disease-causing agent or not. But I always tell them, if you were bitten by one tick, there is a greater chance that you probably had a second tick as well. So if you find one, do more checks. Ensure that you don't have any other tick on them, because ticks live in clusters. It's highly possible that when you get a tick bite, there's a great chance that you got a second or third somewhere. So I would actually encourage them to do more tick checks if they find one.
Now, is your lab receiving ticks that are still alive, or are they dead when they get to your lab?
Majority of the ticks that are sent to the lab are alive. There are some portions that are dead because sometimes people keep the tick in the freezer. So when they are sent to us, it's dead. But I would say majority of them are alive. Ticks are very resilient. They can actually, even if the mouth parts are damaged, when they come to the lab, I can see the legs wiggly, and it's difficult to take a picture of them because they keep on moving. The camera is trying hard to focus, actually. So ticks are very resilient organism. They can live longer, even if they're partially damaged.
This is Upstate's The Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with Saravanan Thangamani, director of the SUNY Center for Vector-Borne Diseases. Can you tell us what you expect this year in terms of tick exposures?
It is not to scare the people, but it is just to inform that ticks and tick-borne disease are on the rise steadily, continuously over the last few years. I can only go as far as back to 2019 because that's when we started the lab. So it is, because the only reason why I'm comparing to my data, it is comparing apples to apples because it's passive surveillance. We are doing this surveillance program in the same way for nearly 6 years now. So I can compare 2024 versus 2025, and that will give an indication what the 2026 is going to be. So comparing to 2024, in 2025, we received 145% increase in the tick submissions, right? Which means that more humans actually got tick bites, 145% increase in the tick submission to us. And majority of the ticks were actually were on the humans. The others were dogs and cats or horses. But still, I would say a good number of them, majority of the are human-bitten ticks. So there is a 145% increase from year 2024 to 2025. So we are just starting the season. And if I can compare the 2025 January to March 20th, and then to 2026 January to March 20, we have seen a 166% increase in the tick submissions, which means that we have not even hit the, I would say the grass is still wet and snow is just melting. I can see through my window, which means that we haven't even started the season, but we already received an increase in the number of tick submissions. If that is an indication, I can speculate this number, the trend in the increase in number of tick submissions, equivalent to number of tick human encounters. That equals to number of human cases that ends up in the hospital, right? Everything is like a chain link. More tick, more human tick bites. more human tick bites, they end up in the hospital, more human cases in the hospital, right? So we are actually predicting that this year it will continue, the increase in number of tick-borne diseases will continue to increase. I don't want to scare the public by telling this information, but that is a reality. That's a hard fact.
Well, what are the factors that are influencing the growth in the number of ticks? Is it all weather and climate?
Weather and climate makes a perfect combination of events by allowing the humans to impact their behavior, right? We have really strong winter, and as soon as the ground warms up, we want to get out, we want to trek, we want to walk with our pet. So naturally, ticks are also waiting in the woods because they are kind of hibernating during the winter period, and they want to acquire a blood meal, and they are out. And when they are out, humans are also out. So these two confluence of events actually impact more tick interaction with humans, right? So that is human behavior and ecology and the weather. Also, the human behavior, we are encroaching the woods, we are building apartments and resorts into the woods, that drives the wild animals out to, I would say, human habitats. So when the deer comes to us, they drop off the female ticks in our property, and then the next season we have a lot of larvae in our property. And then the groundhouse, my backyard has a lot of groundhouse burrows. I see deers crossing every day. I don't live in a really deep rural area. I still consider it a suburban housing area, but we do see a lot of deers. We do see a lot of wildlife walking through our properties, which means that somehow we are in the midst of the, I would say, wild animals that carry ticks and disperse ticks to different areas. So that is also another thing. And also human behavior, like when someone goes to Catskills for a weekend, they get a Lone Star ticks there or Hemophysalia longicornis ticks there that are more common in, I would say, lower Hudson Valley area that are not common in Syracuse areas in Onondaga County. But let's say I go there, my pet gets bitten by the tick, and although no matter how much tick check I do before I get into the car, somehow the tick snuck onto the underneath some skin area. And then I come home, let's say I fail to do the tick check. It starts to feed on it. It drops off somewhere when my pet is kind of wandering off in the yard. Maybe the fed tick will drop off, and then it will lay thousands of eggs, thousands of larvae, which means that a single tick that I actually explanted from Catskill to Syracuse now can establish a population, right? So that is a human behavior, I call it. So we are explanting tick population as well, as good as the wildlife as well. That's my feeling. So it's a combination of events, weather, wildlife behaviors, human behavior. It's a combination of confluence of events that actually allows the ticks to expand. But the one thing is that tick expansion also introduces new pathogens in new geographic areas. When the ticks are explanted, the pathogens are also explanted. The pathogens move with them, right? So that is another issue, is that yes, ticks are a problem, but it also carries and spreads the tick-borne pathogens to new areas as well.
Well, before we wrap up, can you please go over your best advice for avoiding ticks?
So I would say this is the best time for anyone, if they are interested in doing a lot of gardening and outdoor activity, to treat their outdoor clothing with permethrin. There are commercial sprays available. You can spray your outdoor clothing, socks and shoe with that particular spray. That is good for, depending on the product, it can be good for the whole season or for half the season. And then apply DEET products or any other equivalent organic products that can prevent tick bites and also can prevent mosquitoes and other flies as well, right? Sometimes the DEET can protect against multiple things. So you can prepare yourself before going to the outdoor activity. Even after doing outdoor activity, I think as soon as you come home, do a tick check, put all your clothes in the dryer, at least for 10 minutes at high temperature. As I said earlier, ticks like humidity. So once you remove the humidity from the environment, ticks will die. So doing this, high temperature, I would say rinse or wash, and then doing a tick check right away is actually a great thing. If you find one tick on your body or on your pet, please look for more, because there's always more if you find one. So proactively prepare your outdoor clothing. How you dress yourself is very important. And then after you do the outdoor activity, do the tick check. And also know where the ticks are, where the tick habitats are. If you stay in the lane, and the ticks actually wait on the side of the grass blades and try to attach on you. Humans, we can control ourselves. We can walk in the middle of the trail. However, our pet furry friends don't listen to us. They want to wander off the leash and come back. So as soon as they wander off the trail and come back, I'm always worried that, okay, there's now higher chance. So I would actually check the pet check as well. Very important. I think it is very important because they have fur. It is very difficult to find. I would use a comb to actually identify. So I think it is very important to monitor pets as well because they bring the tick inside home. And then they may not be feeding on the pets. Afterward, they will find a human to feed on as well. So that is very important.
This is very important information. I want to thank you so much for making time for this, Dr. Thangamani.
Well, thanks again to have me here to talk about the ticks, tick-borne diseases, and some hard facts as well.
My guest has been Dr. Saravanan Thangamani, the SUNY Empire Innovation Professor in the Department of Microbiology and Immunology at Upstate, the Director of the SUNY Center for Vector-Borne Diseases, and the founder of the Tick Testing Lab at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.